Good afternoon, welcome to our clinic. What can I do to help you out today?
Hello, my dog has mange. I don't know how it got mange. Can you explain that to me and tell me what it's gonna look like when it progresses?
Demodicosis is an altered immune response to a naturally occurring skin mite. Usually it's Demodex canis if we're talking about canines. Demodex canis is normally occurring on the dog's hair follicles, but in the case of demodicosis, they're having an altered, strange immune reaction to it, making them sick. There are two forms of demodicosis. The first form is localized, so that means there's up to 6 small circular patches of hair loss or redness throughout your animal. And generalized is larger patches of hair loss, which can actually take over the whole hair coat, and generalized is harder to manage and more serious.
Oh, I see. How do you guys diagnose it in the back?
So demodicosis is more frequently seen in purebred dogs and puppies up to 18 months of age. It is diagnosed by performing a skin scraping, looking for the Demodex mites from the hair follicles. We can also perform trichography, which can be used on the hair itself. So we pluck a small piece of hair out, we put it under the microscope, and we look for adult mites attached to the hair shaft. If neither of those are positive and we still suspect demodicosis, we can actually perform a skin punch, so we can get deeper into the skin and look for those mites that are buried in deeper.
Okay, I see. How can we help my dog feel better? Do we give it some sort of topicals? Do we give it meds? How do we help my dog?
So treatments are usually mitocidal therapy with adjunct therapy added on as well. It is recommended to bathe your dog with a benzoyl peroxide shampoo before giving topical treatments, just to be sure to flush anything out. The localized form of demodicosis is treated with topical medications. The generalized form is treated using shampoos and medicated dips, which contain amitraz. If there is a secondary infection present, the veterinarian may also prescribe antibiotics.
So, how do I treat my animal? Let's say my dog has localized one day and then next year it's got generalized. I just want to know what I gotta do.
So to apply topical ointment to our demodicosis patient, we are just going to take our topical cream. We're going to squeeze out the amount that it says on our prescription label onto our finger. We're going to wear gloves, and we are just going to very gently apply it to the area. For generalized demodicosis, we want to have a more aggressive approach at curing our patient. So we are going to take our dog, we're going to bathe it really well in the benzoyl shampoo. Then we are going to put on our gloves. We are going to mix however it says on the container, our amitraz. Usually it's with a good mix of water. We only want to make as much as we need because it cannot be used later. Then we're going to take our dip and just pour it over the animal in all of the areas that we have our redness, our alopecia, and then we let it dry. We do not wash this off of our animal. It has to stay to cover the skin and hopefully make your animal feel better.
Okay. And can you show me a picture of it when it's really bad, just so that I know what to watch out for?